All right, so hypertension. Both men and women are equally likely to develop high blood pressure within their lifetime. African American adults have the highest prevalence of hypertension in the US, but blood pressure rises naturally with aging. It's just something that happens. Higher blood pressure increases morbidity and mortality. So, about 65% of Americans aged 65 or older have hypertension. People with a normal blood pressure at age 55 have a 90% chance of developing hypertension, according to recent data from the Framingham Heart Study. So, what is hypertension and what causes it? High blood pressure or hypertension is when the force of your heart pushing against the walls of your blood vessels is consistently too high. So, when your heart pumps, it creates pressure to push the blood out of the heart into the vessels into the rest of the body. So this pressure is always like just hitting those vessels way too fast and way too hard. The major risk factors for the development of hypertension include cigarette smoking, obesity, not being active, high cholesterol, diabetes, age, and race, as we discussed earlier, and simply just being genetically vulnerable to high blood pressure. So, how do I know that I have hypertension? High blood pressure is known as the silent killer because the person who has high blood pressure usually doesn't know they have it until they go to the doctor and have their blood pressure measured and find out that they're having high readings. The diagnosis of hypertension is made on the basis of an average of 2 or more high readings of properly measured high blood pressure on 2 different occasions. So, controlling hypertension is very important. The primary way that high blood pressure causes harm is by increasing the work of the heart and making the heart and the vessels work harder and thus less efficient. Over time, the high pressure can damage the delicate tissues inside the arteries, which can start other problems like atherosclerosis, heart failure, kidney failure, vision loss, stroke, and even a heart attack. So, if you're already at high risk for a stroke, hypertension will not help this, and it's very important to get it under control. So, how do I control or prevent high blood pressure? For both, the lifestyle changes are the same. On top of medications such as ACE inhibitors, calcium channel blockers, or diuretics. Lifestyle management for high blood pressure include lowering one's consumption of alcohol, losing weight by exercising, and diet modifications such as reducing dietary salt intake and following the DASH diet. So the DASH diet stands for Dietary Approaches to Stop Hypertension. It's a diet that's high in fruits and vegetables and includes low-fat dairy products because dairy products are usually high in salt and salt increases that blood pressure. According to the National Center for Biotechnology Information, that is part of the United States National Library of Medicine, economically, hypertension costs the nation about $51.2 billion in 2013. And the total cardiovascular disease cost the nation about $316.1 billion during 2013. So reducing the health and economic burden of hypertension and cardiovascular disease is a public health priority. Research advancement strategies that may alter hypertension or health promotion for the future include steps to learn how to accurately measure blood pressure at home, You can go to the store now and pick up automatic blood pressure cuffs that can either go on your wrist or your upper arm. This can make it easier for patients to record their blood pressures daily while on therapy, or even just to use it to read blood pressures for those who have pre-hypertension. I know that hypertension is one of the top goals for Healthy People 2020. So, yeah, that's one way that you can just watch your blood pressure and make sure it's not too high. And I mean, if you are having high readings, then maybe it's time for you to go see your doctor and go get some medications to help control that. Or you can start doing those lifestyle management and, going out for a walk or a run, or just doing those little things in your diet, keeping the salt shaker away from you while you're at dinner, things like that. So, yeah, that's it. Thank you.